Hi, everyone, and welcome to today's webinar. My name is Cindy, and I am one of the education managers at HealthTree Foundation. I'm very grateful to have each of you here today and for your support in building HealthTree's blood cancer community. At the end of today's webinar, you will have the opportunity to complete a short survey where you can provide any feedback about your experience and offer suggestions for future topics. We love being able to address the topics our community is specifically interested in. So please take a few moments to leave your feedback. Before we get started, I just wanted to recognize the vast number of people who are joining us today, some for the very first time. It's truly humbling just to see how many people are out there and joining us, so thank you. This is the largest webinar that I've been a part of so far with HealthTree, with over 960 registrants at our last count. And these are just a few of the blood cancer types that are represented today by all of you. So thank you. I want to start today by turning the first few moments over to our founder, Jenny Ahlstrom, to introduce HealthTree Foundation to anyone who is attending an event for the very first time, so you can learn more about who we are and what we do.
Great, thank you, Cindy. Welcome, and we're so happy to have you. You're going to be delighted with the conversation today. Dr. Shah is truly amazing, and the work that she's doing is really groundbreaking. So we're excited that you're here. I just want to give a little bit of background about HealthTree Foundation. So I'm a myeloma patient. I was diagnosed in 2010. We started the HealthTree Foundation in 2012 with the idea that we could advance faster cures if we collectively get together and share some of our anonymous data with researchers. We need to get involved. Clinical trials are really important to participate in, and they advance research, absolutely. But there's so much more that we can jump in and do as patients together. And it's just critical that we do this. So when we started, we began with this idea, but then when we launched, I had some very practical things that I needed help with my myeloma, like how do I join a clinical trial and how do I even learn about the research being done in my disease? So we started by creating an educational pillar of support. This lifetime personalized support and education includes everything, and we have very deep expertise. When we decide to expand into other blood cancers, we are mapping out the needs of the community and trying to understand which programs are best. And all blood cancers are not the same, so the needs are different in different communities. So this includes things like our news websites for the different blood cancers, our webinars, our podcasts. We have sometimes virtual and sometimes live roundtables. We have many live roundtables in myeloma. We have extensive videos in HealthTree University, and I just used HealthTree University for DLBCL because I had a friend who was diagnosed yesterday. We have a specialist directory because we think it's imperative that you find a specialist for your type of cancer. We have a journal, and we have live support with patient navigators. Now, we also know that it's important to connect you with each other. So we have our second pillar is these meaningful patient-to-patient connections. In myeloma, and then in some of our newer programs that we're starting to support, we're developing a coach program. So we appreciate your patience as we build some of these programs out into these other blood cancers. But our coach program in myeloma, we have over 250 coaches that can work with you one-on-one. The coaching is free. All these services are free. The coaching is done one-on-one, and you can find people who can help with your situation, whether you're just newly diagnosed or relapsed. We are building out regional care teams that will be cross cancer, so you'll be seeing that. So you'll have ways of volunteering in your community. We have programs that reach underserved communities. So in myeloma, I know in the African American community, myeloma is 2 to 3 times more likely to be seen. And we have Spanish programs, and then we are addressing needs of rural community members. We have a program called HealthTree Connect, which is our social media platform. We obviously will have educational groups and events in this. The most unique thing that we do as a foundation is that we are more like a tech startup than we are a traditional advocacy organization. As you can see, we do all the traditional advocacy, but we have a software internal development team, and they have developed over 14 different software tools to make all of this happen. It's all integrated, it's single sign-on to make it easier for patients to join. And in this data portal, we open this data up that I talked about to the research community in an anonymous way. So we want these researchers, and this project that Dr. Shah will be talking about today is one of the projects that we are doing for her. So we can have doctors come to us and say, show us the sequencing of different drugs that are being given, or we're running, for example, a 3-year bispecific antibody study. What was the patient experience like? What's the caregiver burden like? We'll be doing the same thing for CAR T. We ran a large decision-making study last year, and we had over 800 people respond because we need this type of research happening. Our goal is to shorten this research down from years to months. We can turn around information quickly to the researchers, and they're helping cure us faster. So we can become these cure contributors and help advance a cure in our own diseases. And we invite you to do that. Okay, next slide. What I'd like to do is just share, we'll just play the video.
Technology has completely transformed our daily lives. It's unlocking new possibilities and experiences we couldn't imagine just a few years ago. And yet, despite decades of research, we don't have a cure for most cancers. And technology hasn't been properly used to enable us to find those cures. I was a wife and mother of 6 small children when I was diagnosed with multiple myeloma in 2010. This blood cancer diagnosis was shocking. I needed to survive, and I didn't have the luxury of waiting for someone else to build the tools that I needed.
The data that Jenny needed to make informed decisions should have been right at our fingertips, but it wasn't. Healthcare is one of the only industries left in the world that acts like the internet doesn't exist. And after working in the tech startup world for the last 30 years, we needed to reimagine a system that would allow cancer patients to share their data, share their experiences with the doctors, with researchers to find cures faster. So in 2012, HealthTree was born. We focused first on the needs of patients like Jenny, patients who need information and tools to help them work with their doctors to make more informed decisions. And then we turned to doctors and researchers who also didn't have access to all the patient outcome data. Details about patients' illnesses are spread out, data sitting in multiple databases across many organizations. In fact, most of the data is sitting in patients' heads. Doctors, researchers, and drug companies all have regulations that restrict what information they have access to.
We realized that patients are the only ones with the freedom to share their own medical details. We believed if more patients knew this and could do something about it, they would want to help. And we were uniquely positioned to take on this challenge.
We assembled a talented team of software developers to build completely new technology that links patients, their medical information, and researchers together. HealthTree Cure Hub offers patients the data and the tools they need to make life-saving decisions in partnership with their doctors. It's like the dashboard on your car, but it's for your health. HealthTree Research Hub is a living, interactive platform that continually and securely provides confidential data from thousands of patients to researchers seeking to answer key questions about cancer.
Today, 14,000 myeloma patients share their information with HealthTree. That large data set allows researchers to learn more about myeloma faster.
This life-saving platform should exist for all cancers and all diseases. And that's why we're expanding it to all blood cancers and in the near future, solid tumors.
We are determined to find a cure, and this is only the beginning. Join us in changing the way cancer is cured by becoming a cure contributor. Join HealthTree today. Technology has
There we go.
So that is our why. This is why we're doing this. This is why we came up with this technology. We've spent tens of millions of dollars developing this technology, and we can integrate with over 2,900 hospitals to pull EHR data. We have a medical team that can validate the data and then open it up in an anonymous way to the research community. So we would just invite you, Marisol will be putting a link in the chat that you can use to sign up for HealthTree Cure Hub. If you have any questions about the process or how this works, we have a patient navigator team of people who you can talk to over the phone. You can email them and they'll call you. But connecting your medical records takes less than 30 seconds. So it's very easy to connect, regardless of how many facilities you're going to. You can be going to an academic center and a local center and connect all your records, track your labs in a single place. And we're in the process of developing this for all the different blood cancers. So thank you again for the opportunity to share what we're doing. We're very excited. We haven't seen anything like this from any other organization. And it's really new and unique and different to be able to invite you to participate in research that's going to help find your own cure. So we invite you to do that today. Okay, with that, I'll turn it over to Cindy.
Perfect. Thank you so much, Jenny. It's always wonderful to hear from you and to hear your inspiration and where we came from and where we're going. So thank you. We'll keep moving with today's webinar. As always, we would like to thank our sponsors without whom this event would not be possible: Pfizer, Regeneron, Johnson & Johnson, AbbVie, GSK, Karyopharm, Bristol Myers Squibb, Sanofi, Adaptive, and Genentech. So this meeting is being recorded and will be emailed to all of those who registered for the event, along with any slides and resources that we discussed today. The recording will be available on both our website and YouTube for other patients like you who want to watch and learn. We'll address any questions or comments as they come in. All questions for our presenters will be answered during the Q&A at the end. If you'd like information about additional Zoom features, we're happy to assist you in the Q&A that's always being monitored. So to access that Q&A, click on the Q&A icon at the bottom of your screen. If you're using a mobile device or tablet, you may need to tap on the three-dot icon in the upper right-hand corner and then tap on Q&A. We strive to make all of our events accessible, providing live closed captions. So you can turn them on or off according to your preference. If you are using a desktop, click the CC in the bottom left corner of the screen. If you're using a mobile device, click the three dots in the upper right corner and then click Show Captions. As Jenny mentioned, as we go along, we'll be dropping links to the studies that are mentioned today, along with other resources into the Q&A. And all of these resources will also be emailed out to you following this presentation. So today's topic is dietary research in blood cancer, exploring the impact of a plant-based diet. We chose this topic because there is some very amazing research on how a plant-based diet can affect your health that our speakers, Dr. Urvi, Shah, and Francesca Castro, will be sharing with us today. And all of it is quite encouraging, so we're excited to hear from them. The thing that I'm compelled by is I can imagine how out of control it might feel with any sort of cancer diagnosis. But when what we choose to eat gives us a little sense of control, I think that's very important to take that back to control if we can. So let me take a moment to introduce today's speakers. Dr. Urvi Shah is a faculty member on the Myeloma Service Division of Hematologic Malignancies at Memorial Sloan Kettering Cancer Center. Her research focuses on studying the role of diet, microbiome, and other lifestyle-related factors in plasma cell disorders, as well as identifying interventions to improve outcomes for these patients. She also studies immune therapies, including CAR T cell therapies for myeloma. Dr. Shah has a unique perspective that we're excited to hear about. She herself is a lymphoma survivor and will be sharing some of that experience with us today. Having that experience gives her such a great amount of compassion and understanding for what her patients are going through. So we're excited to hear from her. And also we'll be joined by Francesca Castro. As a level 3 clinical research dietitian nutritionist, Francesca Castro focuses on providing whole food, plant-based diet interventions to patients with myeloma with the myeloma service. She joined Memorial Sloan Kettering Cancer Center in December of 2021. Her special interest includes the impact of diet choices on both cancer prevention and progression, gastrointestinal microbiome, and evidence-based clinical care. She earned her master's in nutrition and exercise physiology at Teachers College, Columbia University, and her bachelor's in biomedical science at the University of Central Florida. She's a registered dietitian with the CDR and a registered dietitian in the state of New York. When we asked Dr. Shah to speak today, she was very excited to include Francesca. So I'm very much looking forward to hearing from both of them today. And it is such a treat to hear all of the exciting research that is going on and has happened. So with all of that, I will turn the time over to Dr. Shah and Francesca.
Good afternoon, everyone. Really great to see you all virtually, and I'm really glad you were able to take the time to join in the middle of the day. We're talking about dietary research and blood cancers overall and what we've done mostly in myeloma at this point, but hope to be able to take it beyond just myeloma. So I'll talk a little bit about diet and cancer risk, microbiome, and some basics that we know about it, some of our trials that we're doing, especially the nutrivention trials, and then some practical tips we'll finish off with. And as Cindy just mentioned too, I'm going to share a little bit about my background so you get an understanding of how I got to this place and why I do this research. So I did medical school in India, and my medical school training was very similar in some ways to medical school training across the world, where people focus a lot on understanding the disease, but there's not too much focus around nutrition and how to prevent disease. And so I didn't learn a lot about nutrition then. I went to Tufts for my residency in Boston, and Tufts has a really good hospital, so a lot of very sick patients with very advanced needs and like heart failure, kidney failures, things like that. I managed a lot of different diseases, but even during that time, even though Tufts has a really good nutrition school, I didn't think about it or even mention it to my patients. I went to a fellowship at Montefiore in New York, and during that fellowship, at the end of my first year, I was actually in my heme malignancy or blood cancer rotation on the inpatient side, and noticed some fatigue and lymph node swelling, and then was diagnosed with Hodgkin's lymphoma myself. That experience where I had patients and friends and family members telling me, maybe eat this and try this supplement, I realized that we really don't get much training. Despite being a doctor, I'm not fully aware of that evidence. And so for me, as a side hobby, I did start reading up about nutrition and realized there's plenty of data. It's just not spoken about enough. And so I decided that at some point I'd like to do these kind of studies, but being a fellow at that time, I didn't think it was really feasible. So I focused my research on genetics, epigenetics research in actually a lymphoma called adult T-cell leukemia lymphoma. And then I went to MSK, and there I was actually studying CAR T-cells, immune therapies as a fellow, and then transitioned to faculty. As faculty too, I thought that that's what I would be focusing on mainly, is immune therapies. But then I decided to start with this one nutrivention trial, the pilot. And then one trial led to the next and the next. And now we have multiple trials, 4 currently ongoing, and hopefully many more to come in the near future. So the reason I want to talk about this is I think what food or supplement should I take is such a commonly asked question, probably the most likely question I get. And in my training, I have experienced this and seen that it's also the least likely question to be answered by doctors. And I think that's why dietary research and nutrition infrastructure to support patients in cancer is really an unmet need. And to get this support, we kind of need to bring in the research and the evidence to have people believe it and then add that infrastructure in. So my focus has been at MSK to study nutrition, microbiome, and the metabolism in cancer and understanding it. So one of the things that I often get oncologists and tell me is like, oh, maybe we shouldn't be telling patients what to eat beyond, like, we should tell them eat a balanced diet. That's what we need to tell patients. And I would like to ask all of you, how many of you know what a balanced diet is? And I've found that in my experience, not a lot of people know what a balanced diet is. And even a lot of doctors do not know this. And so when we think about the USDA recommendations, the recommended daily intakes for fruit is about 1.5 to 2 cups, vegetables 2 to 3 cups, fiber is over 25 to 30 grams. And if you look at a score of a healthy eating index, meaning an ideal diet, that would, based on this one score, a score of 100 is the perfect score. And you can see that in the US, we have much different numbers compared to this in terms of meeting the recommendations. So I don't know if any of you have heard of something called the fiber gap. And this was something that, we have like an optimism or positive bias sometimes in what we do. So we assume we're doing it, but we're not. So when patients were surveyed, or individuals, just healthy people were surveyed and asked, do you eat enough fiber? They said, yes, 67% said, yes, I get enough fiber in my diet. But actually, when actual diet was looked at, less than 5% got enough fiber. So you can imagine, like, there's such a gap or discrepancy in what we think we're getting versus what we're actually getting. And you can see here that the number of Americans meeting these daily intakes is so low. Fruit is only 12%, vegetable only 10%, and the guidelines less than 20%. And we're just talking about the general USDA guidelines. So when people say the guidelines don't work, it's more like people don't follow the guidelines, and so they don't work. And I think that there had been a recent study looking at cancer survivors too, and these numbers are not very different. It's very similar in terms of the number of patients meeting these guidelines. So I think there's a lot of room for us to improve on those things and see the benefits for ourselves directly. So some of the evidence that I wanted to talk to you about was pre-diagnosis dietary patterns and cancer. And remember, with nutrition studies, often the studies are based on population-based studies. So meaning people are asked to fill out surveys, thousands of individuals, and then they are followed over decades, and then they see who develops cancer. And then based on the dietary patterns, they could say like certain individuals that are at a higher risk versus certain individuals that are lower risk. Of course, we're not saying a certain dietary pattern will prevent or completely prevent someone from ever getting cancer, but what lowers the risk of cancer. And you can see that there's the one study from UK, one from USA, and one from France. And each of these studies had lots of people, over 60,000, over 40,000. And you can see that in these three studies, they divided the dietary patterns in different ways. And some of them, they classified them into vegans, vegetarians, meat eaters, fish eaters. In some, they said vegans, vegetarians, non-vegetarians. And in the other, they based it off a dietary score. But all three of these studies had very consistent findings that those who ate more plants had about a 15 to 20% lower risk of cancer. When we looked at myeloma, and some of this data I'm showing you in the context of myeloma, but there are studies like this in other blood cancers too. And you can see here that in this cohort from the UK, remember myeloma is rare, so there were only 65 patients out of the 60,000 who developed myeloma, but the vegans, vegetarians had a 77% lower risk of myeloma than meat eaters. So when it's 0.23, that means a 77% lower risk. Now, this is a small study in terms of the number of cases, so we have to take that number with a grain of salt and understand, like, there could be some error within that, but at the same time, the direction of the association is important. Similarly, with inflammatory diets, you can see that we are seeing similarly that more inflammation is associated with an increased risk of cancer. We looked at the NIH ARP study, and in this study, which was the largest study of myeloma patients to date, you can see that patients who were eating more plant-based foods had a lower risk of myeloma by about 17%. Basically, we divided the patient groups into 4 quartiles based on the highest versus the lowest intake of plant foods. And then we also looked at the NHANES. So this is a completely different study. And for those of you who are not familiar, MGUS is a precancer stage 2 myeloma, and some patients with MGUS may go on to develop myeloma and some may not, but it is an abnormal, like a blood disorder that we can see in the blood. So we looked at the patients with this precancerous blood disorder, about over 300 cases with the disorder compared to 1,400 controls without. And you can see that those who had more sugar-sweetened beverages and drinks, both artificially and naturally sweetened, had about a 30 to 60% increased risk of developing MGUS, versus those with eating more fruits, vegetables, whole grains, and cruciferous vegetables too, had a similar 30 to 60% reduction in the risk of MGUS. So you can see that many of these studies I'm showing you, whether it's overall cancer or specific cancer, it is very consistent in its findings. And we can also think about mechanisms of how does dietary patterns reduce cancer risk. And a lot of it is through, fiber improves microbiome, improves short chain fatty acids. There are also fiber and plant chemicals, which are called flavonoids, that have anti-cancer, anti-inflammatory properties. When there's fiber, there's less constipation, so less time for these things to stay within the colon and cause risk. That's more for colorectal cancer. And then also better weight management, less inflammation, and insulin resistance also improves. So these are some mechanisms. I'm not sure if you all know about these World Cancer Research Fund guidelines, but if you don't, I encourage you to go to this website. There's a lot of information here. I'm just showing you the summary, but you can see that out of these 10 cancer prevention guidelines, 6 out of the 10 are actually related to diet, and the others are indirectly related to lifestyle too. And what you see is that they also talk about a diet rich in whole grains, vegetables, fruits, and beans, and limiting sugary drinks, red and processed meats, and fast food. And the reason why they come up with these guidelines is based on looking at thousands and thousands of papers across the country and world in terms of research around diet and cancer, and say, what are the common themes that we see here? So now just shifting a little bit to the microbiome, because I think this is something you're probably are hearing more and more of in the news, and just wondering, how does this apply? I think that we're going to see a lot more in the microbiome space over the next decade, and we're just starting to scratch the surface of it. So a question for you all is, do we have more human or bacterial cells in our body? And while, since I'm asking the question, you probably know the answer, it is surprising, but we are more bacterial cells than human cells. So 38 trillion compared to 30 trillion. However, the reason you don't see the bacterial cells is because they're really tiny compared to our human cells, which are much larger. So by weight, of course, human cells are much more. So it is because of that, I think, really important to think about what does the bacteria or the microbiome want to eat so we can feed them. And fiber is what they really like. And you can see that when we think about the gut microbiome, there is what we want is like homeostasis, means gut balance, like there's a proper balance between the microbiome, the lining of the gut, and the immune system. When there is dysbiosis, meaning that the gut microbiome is not doing so good, the barrier or the intestinal lining starts getting inflamed, and that inflammation moves towards the blood and systemically too. And you can see here that in health and disease, the microbiome is often thought about now as to be at the center of a lot of things. And if we can modulate this and understand it better, we would be able to help a lot of patients. So what we do know about the microbiome at this point, and in cancer especially, is one term called microbiome diversity. I want you to understand this term, because if you look at any cancer paper around the microbiome, they will always talk about this concept, because I think it's one of the most important things we want to see in the microbiome. So a healthy microbiome is one that has enough variety, like think about a rainforest with flora, fauna, different species, plants, all of that. A plantation, on the other hand, is like just one kind of tree of the same size. So we want a microbiome that's like a rainforest and not like a plantation. And that's what a more diverse microbiome is considered to be. When we look at microbiome diversity in most cancer studies, it's very clearly linked that those with higher diversity have better survival, whether it's progression-free survival or overall survival. And I've seen this consistently in so many different studies. So what affects microbiome health? And diet is one of the biggest drivers of it that's modifiable, so that's nice. But remember, we need consistent changes, because if you make the change today and tomorrow you stop, it doesn't keep the microbiome adapts and probably will go back in some ways. So how do we improve gut microbiome diversity? One study had shown that the composition of the microbiome is improved if people are eating more variety of plant foods in their diet. So if you get 30 plus varieties per week. So when we're talking about every week, we're saying if you are eating a soup and a soup has carrots, potatoes, and onions, that counts as 3 different plants. So that would be 3 for the week. If you have a multigrain bread or you have a fruit salad with many different fruits, then each fruit is counted as 1. But if you have 3 servings of onions on 3 different days, that doesn't count as 3, but as 1. So that's the way this study had calculated it. Other things is getting enough fiber in the diet helps microbiome, and also fermented foods. Now, moving on to the research we're doing, I think because blood cancers, most of them have these precancer states, we have an opportunity to understand, can we delay progression to the cancer with these lifestyle and microbiome changes? We do know that as the disease progresses, genetic changes increase, and that leads to the disease becoming more likely to progress. And generally, it's a balance between the genetics of the cancer and the immune function trying to keep the disease under control. And you can see that these are some modifiable factors, meaning things that can affect the immune system. And potentially, we wanted to study to see is if we can impact the immune system with these factors, is it possible that we strengthen the immune system and slow progression for some patients? And so that was why we decided to do the Nutrivention study. You can also see in this study, which looked at weight, BMI, and risk of progression, that patients who had a normal BMI had a lower risk of progression, so hazard ratio of 1, but those who had an elevated BMI had a hazard ratio almost 2, meaning double the risk of progression, and you can see the risk increasing with increase in weight. And this is similar in another study to exactly the same, that the risk is almost double with an elevated BMI. So because of these studies, we decided to do the Nutrivention trial where 20 patients with a BMI over 25 with MGUS and smoldering myeloma were included in the study. Patients got 3 months of a high fiber plant-based diet, 6 months of coaching, and they were followed for a year on the study. We shipped them lunch and dinner for 12 weeks. We would send them frozen meals once a week in partnership with a company, Plantable. And what you can see is that it was very feasible. So we wanted to make sure that patients could actually do this. And you can see in blue is what the patient's diet was before they started the study. And we calculated the unprocessed plant foods. And you can see that it was about 20%, the adherence to unprocessed plant foods out of their total calories. And this increased to 90+% on the study time. And even after a year, when we had stopped giving the food, it was much better than where they had started, because I think the patients felt the benefits and kept it going. We also saw that patients lost about 7% of their weight and maintained that weight loss. Remember, we enrolled patients who had an elevated body mass index, so had overweight or obesity. So we were expecting some weight loss, and a 7% weight loss that's maintained is very good. We also saw that quality of life improved, so patients felt better. Their overall health, they felt better, shortness of breath improved, and fatigue also somewhat improved. Additionally, we surveyed the patients and we said, are any of these other symptoms improved for you? Of course, this is subjective, this is patient response, but you can see we got 15 responses back, and you can see in green are the bars of things that patients felt improved. Like some also had improvement in depression, anxiety, some in sleep, joint pain, GI issues. We had one patient stop an antidepressant. We had one patient stop insulin. So we had patients able to stop medications too. And all patients reported the intervention to be easy to follow, and some were able to save money because they stopped medications. So with that, we also looked at markers in the blood because we wanted to understand. Remember, I showed you the mechanisms of how diet may affect cancer. So one was insulin resistance. So we want insulin levels to be low, and we saw that the insulin levels actually reduced on the study despite them eating more plant foods, which could be rich in carbohydrates, but these are complex carbohydrates, and so their insulin improved. We can also see that the microbiome diversity, remember I said that higher diversity is good, it significantly improved over the study up to a year out as well. So it remained high as well. We also saw cholesterol improve by about 20 points. It came down, and we also saw 7 patients had an elevation in their inflammation marker called CRP, and this reduced by about half in those patients. So the most important thing you might ask is, what about the trajectory of disease progression? So it's hard to study that in a short period like 1 year, because sometimes these things takes decades to change. But we had 2 patients whose numbers for the 5 years before they went on the study were gradually increasing. And you can see for these 2 patients, the blue line shows you how their disease was moving before the study, and then in red shows you on the study. And these were significant values in terms of slowing off progression for these 2 patients. Of course, the rest of the patients, some had low-level disease that was stable, some had disease that some may not have had enough weight loss. So every patient is different, but these are 2 patients that clearly seemed to have a benefit. This is one of the patients on the study who shared his picture with permission, but this was before the study and this was after. And this patient was able to stop insulin too after being on it for over 30 years. So it is really possible to improve diabetes, weight, inflammation, all of these things, and we're seeing. Another thing we did, this is in collaboration with Dr. Matteo Bellone, who is in Italy, and Laura in his lab. And what we did was in his lab, he took mice who have smoldering myeloma, so the precancer state, and these mice are known to progress to myeloma eventually with time. We gave half of those mice their standard mouse diet, which is what they normally would get. And then half the mice got a high fiber diet, meaning the same kind of diet, but with more fiber in it. And surprisingly, we saw that the mice who got the high fiber diet, they took double the time to progress compared to those that got the control diet. And on top of it, when the experiment ended at 30 weeks, half the mice in the high fiber diet had not even progressed. So the experiment ended with them remaining as smoldering myeloma, whereas in the control diet, all the mice had developed myeloma by the end of the experiment, suggesting that, fiber may have modulated this disease progression. So with that, we have the Nutrivention 3 trial that's enrolling at Memorial Sloan Kettering and also at Emory in Atlanta. With this study, you could be anywhere in the US, but as long as you have MGUS or smoldering myeloma and willing to come about 5 times to MSK in New York or Emory in Atlanta, you can enroll on the study. We would ship you the intervention and the rest of the things to where you live, but you would need to be able to make the trip to one of these sites. I know that this can be challenging and difficult for patients, though some have chosen to do this. We are not covering travel expenses, unfortunately, but we will cover the cost of the diet and the supplements and the diet, like coaching and all of that, of course. So because of that, I think, we want to bring these interventions and these trials to people and patients where they are, so they don't need to come to us. And that's why we started the Nutrivention 2 trial with the HealthTree Foundation. And this trial is a decentralized trial, meaning you can be anywhere in the country, only within the United States at this time. We have not been able to make it international yet, but this is patients with smoldering myeloma. So with that, I'll hand it over to Francesca to maybe talk to you for the next 10 minutes about the Nutrivention 2 trial, and if you had questions about it and how to enroll. And then after that, we'll wrap up with some nutrition tips as well.
Thank you, Dr. Shah, for laying the foundation of our research and discussing some of our results. So as Dr. Shah said, Nutrivention 2 is our current telehealth-based trial that is enrolling. This study is being done and it's unique because we are trying to see if microbiome improves rapidly in 2 weeks and might be potentially useful in delaying disease progression. And how does this help the myeloma community? Currently, as Dr. Shah said, we do have really good data surrounding the microbiome, but it is still limited. So studies like this allow us not only to better understand the microbiome, but also better understand its relationship to health, overall health, cancer risk, cancer survival, and disease progression. And this is a figure from our diet microbiome review with a mechanism as to why beneficial diet changes might change the microbiome in a beneficial way. So this study is currently enrolling. If you're wondering if you're eligible, I put a few markers here. What's important is that you're diagnosed with smoldering multiple myeloma and have documentation. So I know Jenny talked about the Cure Hub. This study is easy in the sense that you just have to connect and make a Cure Hub account and then connect your medical records and we'll see if you're eligible. As Dr. Shah mentioned, you also have to be residing in the United States, at least for the duration of the study period, and then be 18 years or older, have access to a smart cell phone or tablet device, and not be currently following a whole food plant-based diet, and then also be willing to comply with all study-related procedures, which I'll clarify in a second on the next slide. So some study-related procedures for this study is just willingness to share the medical information. As Jenny mentioned, it's a completely secure method of sharing and very simple. And then also for this study, you do have to be willing to stop supplement intake unless there's a need by a medical care provider for you to take the supplements for the duration of the trial. Though I mentioned that the intervention period is 2 weeks, the actual time in which you'll be communicating with HealthTree and MSK is 8 weeks, so you have to remain off the supplements for a total of about 8 weeks. And then a willingness to discuss upcoming travel dates, that is solely for coordination of shipments of the stool samples and the meals and the supplements. And then you'll have to ship the supplements with our prepaid shipping label. And then additionally, you'll use that smartphone device to log in food intake and weekly weights, as well as communicate with the research team. Some frequently asked questions that we get for this study is, how involved is the stool sample? It's a very easy stool sample collection that is, you will get detailed instructions, no refrigeration is required, and as I said, all the packaging information will be provided with very detailed instructions. And then another question that we get is, can I make diet changes if I'm randomized onto the supplement arm? So no, you're encouraged to not change your diet during the 2 weeks of you being on one of the supplement arms. But if you would like more information about dietary changes, you can do that once that 2-week period is over. And then if you travel for work, as I mentioned, if the travel is coordinated, we can make something work most likely. And if you have any questions, always just refer to HealthTree and their wonderful patient navigators. And then additionally, if you're eating plant-based already, as I mentioned, that is in the eligibility criteria to not be eating plant-based, we can discuss if you're plant-based and do a formal, what we call a dietary recall to determine if you're eligible based on the percentage of whole food plant-based that you are. And then will you be charged or your insurance company charged for this type of study? No, all the costs, including the shipping, including the visits you have with myself and the team, will all be covered by the study. And then if you have additional questions, I know Jenny and Cindy mentioned the contact already for the patient navigators, but I also put them here on this slide. And then going into the study timeline, just to give some insight, there's a screening period where you share your records, a pre-intervention period where you'll do some surveys and stool collections for baseline measurement, the intervention period, and then the post-intervention period. So I put some estimated times. This is not exact, it depends per person, but I tried to give some insight. A lot of the time needed is for surveys and just back and forth communication. I have some more details in the following slides. So for the screening visit, as Jenny mentioned, you'll create a HealthTree account. You will complete a 15-minute survey to find out if you're eligible. And then once you're deemed eligible, you can share your records in CureHub. If you're unsure, you can still share your records in CureHub. These are the medical records needed to determine your eligibility. Things like your last oncologist note, your bone marrow results, if you've ever had any bone marrow done, imaging results, if you've ever had any imaging done since your diagnosis, routine labs within the last 6 months, including any myeloma markers, CBC, complete metabolic panel, and then vitals and height and weight. And then for the pre-intervention period, I'm not going to read everything here, but it includes surveys, it includes some orientation to the study in general to answer any questions and concerns you have. And then it also involves shipping 2 stool samples during that pre-intervention period, and then logging into that Quinoa app food intake. And then during the intervention, you'll start on a Wednesday. You will either start the diet or curcumin or probiotic or omega-3, and then you will ship 2 more stool samples, one at the end of week 1 and then one at the end of week 2. And during those 2 weeks period, you will communicate with the research team, complete surveys, and complete pill diaries. And then the post-intervention period, you'll just have a wrap-up visit with everyone just to give your feedback and take a survey and then finish up any outstanding documents. And I put a QR code if you are interested in joining. You can scan this QR. I believe it will bring you to the survey, and I believe Marisol will also be putting a link in the chat for the study. Thank you all.
So with that information about the study, we just wanted to mention a few tips. Francesca can also add in, but these were some goals based on the evidence. Maybe, it's important not to do everything where it might overwhelm you. So if you are the type who wants to make changes quickly, you can do many things at once. But if you feel like it's too much and how do you do that, maybe start with one thing at a time. And these are some goals we suggest for you to think about and pick one at least to begin with. And I just wanted to conclude with a few things and why I think it's important that we look after ourselves and what does facing cancer have in common with climbing a mountain. And I think that I'm just showing you a picture of myself as a patient and as a recent hike that we did to Peru to fundraise. And what I can say to you is for both of these things, we're really putting our bodies through very hard challenges and we want to be our fittest as we face them. But so that's what I think is common between the two things, though I would say that having gone through both, going through cancer is much harder than, of course, climbing a mountain. But I think that since you are all going through that, I think you're up for the challenge and able to look after yourselves and think about it. So I think that it's very important if we're going through something hard that we at least have ourselves in our fittest shape to be able to handle the treatments and to be able to live not just longer, but better as well. And so we were 8 women myeloma physicians who had climbed 30 miles in the high altitude at over 17,000 feet in Peru and raised over $29,000 for myeloma foundations, including the HealthTree Foundation. And just to tell you that eating well doesn't have to be boring. This is what I ate in Peru, and my time I enjoyed the food and had really good, colorful, tasty food the whole time. The last thing I wanted to mention was that please consider also participating in this dietary survey through HealthTree that we're doing. And we're trying to understand dietary patterns within the plasma cell disorder population at this time, but maybe at some point we will expand to other cancers. But we're trying to see if there are differences in different ages, races, other things. And when you finish this questionnaire, which takes 30 minutes, eventually we are able to send you a summary of your dietary pattern as well at certain periods once we analyze the data. So with that, let's change our focus, not just from living longer, but living better and longer. And I think that what we've shown you, I hope, empowers you to think about how you can improve quality of life, even though you're going through something so hard. And incorporating nutrition and fitness, these things do matter and do improve quality of life, as we have shown you. So I know the first steps are always hard, taking that first time to go out running or first time hiking or making the first change with your diet. But once you do it and it becomes a habit, it becomes easier. And I'm saying this from the recent hike too. I started exercising more regularly because I had to for it. And now I've tried to incorporate it as a habit into my life, which I wasn't doing before. So now it's become easier. But the first month is always hard as we try to incorporate it. So with that, the things we'd like to do is we'd like to do more such trials. Of course, funding is always the challenge, and that's what slows us down in being able to do it. But we'd like to do trials in myeloma, in other blood cancers, in different settings. But at this point, these are the studies we are doing. So with that, I'd really, really like to thank the HealthTree Foundation for their partnership and support over these years, without which all of these things would not have been possible, especially Jenny, Jay, and the whole team of the research team in HealthTree Foundation, and also patients who've been willing to give their time and effort to take part in this, Francesca, our research team, Janine, and all of our collaborators and colleagues, mentors, and funders. So thank you, and we're happy to take questions.
Perfect. Thank you so much, Dr. Shah, and Francesca and Jenny. It was a pleasure. There was so much great information in all that you shared. So we've got just a few moments for questions, and we did get quite a few that came in. So we will try to be mindful of everyone's time and get to as many as we can. But of course, if there's questions in here that don't get answered, we'll try to tailor a future webinar towards those most popular questions. So one question I'm sure you get asked a lot is, how do you get enough protein using a plant-based diet?
Yeah. So Francesca, do you want to take that?
Sure. So there is this, I would call it a myth, that you can't get enough protein on a plant-based diet. You definitely can. There's some really good resources out there from American Institute of Cancer Research that Dr. Shah shared. Really what comes down to it is having a diverse diet. So going back to that study that Dr. Shah mentioned, which included having at least 30 plant foods a week, that is a way to get enough protein in the diet from plant-based foods, and really aiming for 3 to 4 servings of high protein plant-based foods like lentils, beans, peanut butter, legume-based pastas, things like that. I think Dr. Shah has a wonderful slide kind of showing you how much protein is actually in a plant-based diet and how much fiber. What is actually awesome about plant-based protein is you're not only getting protein from it, you're getting all of these important phytonutrients, fiber, healthy fats, and additional benefits from them.
Great. Yeah, I just wanted to put this slide up because I think it kind of hits home the numbers. So this is like protein requirements, and you can see that if somebody needs about 0.8 grams per kilo is what a 60 kilo, what is the normal RDA. But if it's on the higher end, if you think like, oh, somebody has cancer or they're older and they need more, so it would be somewhere for a 60 kilo person between 48 to 72. Just made up a diet of what could be a high fiber diet or a Western diet, and you can see that the protein in the high fiber diet is also reaching the higher end of the needs of the person, and so is the Western diet, but it is definitely. And when you look at that same diet with the fiber requirements, only the high fiber diet is actually meeting it, and the Western diet is not. So you're not getting enough fiber if most of the foods are not coming from plant foods, as you can see here. And even in this Western diet, I've included like a whole bag of frozen broccoli, which really adds to most of the fiber, but many people wouldn't even eat that. So I've kind of potentially been generous here in the amount of fiber the person's getting. What are the
Uh,
other questions?
I was going to say that is perfect. I've heard so many people have that question about getting enough protein, all these fiber requirements as well. So that's perfect. Um, we've got a question. I know I've got a lot of multiple myeloma patients on today. I've got one that says, um, I want to know if a plant-based diet will help me manage my cancer. So I guess it's speaking broadly to the multiple myeloma patients, but also any research out there for the other blood cancers as well.
Yeah, so one thing I would say is that, of course, these are generalizations. So you have to individualize it to your cancer, the setting, the stage. I see somebody else asking where they feel like they're doing well with the myeloma and they are not sure if they should make any changes at this time because they lost the weight and kept the weight off. Again, I think that the principles in terms of the goals that we talked about, I think these are not things about whether it's a plant-based diet or whether it's a regular diet. These are the goals from a healthy diet from even USDA guidelines. So you can just think about it more from the point of like, are you getting enough of some of these important foods in your diet? And do you want to make changes for that? Whether the research specifically to your cancer shows it or not, the research for overall health in terms of cardiovascular disease and in terms of diabetes and other things also consistently point towards these healthy patterns, right? So you are making these changes not just for the cancer, but also to prevent these other disorders as well. And you can see here the Canada's revised food plate, which is half the plate is fruit and vegetables, a quarter is carbohydrates or whole grains, that is, and a quarter is mostly plant proteins, but there may be a small amount of animal protein. So that is your decision of how you decide the plate. When we're talking about this, it's just to show you that the majority of patients are not getting enough fiber, and fiber is important, not just for cancer or specifically myeloma, but I think the benefits are beyond all of this as well. So you have to decide whether it's possible for you to do, and if it is, you feel better on it or not.
Perfect. We'll ask just one more quick question because I know there's some interest in your gut microbiome. Patients are concerned about the proactive antibiotics that are prescribed to avoid infection. Do they do harm to the microbiome? And if so, what kind of probiotics should they be looking at? And how does food play into that? Lots of questions there, but
Very
we'll
good
try to get as
question.
many as we can.
Yeah, it's a very tough question to answer because we don't have as much data specifically on each antibiotic and saying like what it does. We do know that there are studies showing that taking the antibiotics, or we need them to prevent the infections at those periods, but we can do it. And we know that antibiotics do affect the microbiome. But we also know about the things that can positively affect the microbiome, like we've talked about. So I think that especially in patients who are taking the antibiotics and things, they may need to do a little bit more of the other things to try to keep the microbiome healthy. And some of it you would notice too. Are you having bloating? Are you having regular bowel movements? Things like that. Is it diarrhea? Is it form? Things like that help you understand, is the microbiome doing well? And the last thing you asked about in terms of probiotics, the data is mixed. Like probiotics do help when somebody have dysbiosis in terms of diarrhea post an infection and they got antibiotics and there's some perturbations in it. So it might help to normalize it. But long-term use of a probiotic all the time has mixed results, where sometimes it may help, sometimes it doesn't. And in melanoma, a type of skin cancer, actually patients who were on checkpoint inhibitors, which is an immune therapy even used in lymphoma, patients who had enough fiber in their diet but also took probiotics actually did worse than patients who had enough fiber and didn't take probiotics, suggesting that maybe the probiotics might be reducing diversity in some ways, and it may not be good when it's combined with immune therapy. So I would not just take a probiotic because it's supposed to be good. But if you're feeling like the probiotic actually helps you feel better in terms of your gut feeling better, then maybe that is something you need. And everybody's microbiome is different too. So a probiotic that helps one person may not help the next person, because each probiotic has different bacteria. So you might have to see what works for you, but I would not recommend probiotics across the board for everybody unless they're specifically have a certain period at which point it makes sense clinically for a short period.
Okay, perfect. And as I mentioned, again, we've got so many great questions. Outside of looking at webinars and stuff, we'll also send some of this over to our writing team and see if we can get some really good articles written on the subjects that we weren't able to touch on today. So again, I want to thank you, Dr. Shah, Francesca, Jenny, for joining us today. We will go ahead and wrap up. So I'll go ahead and share my screen. Okay, perfect. So of course, today we did cover a lot of information specifically for our myeloma patients, which is wonderful. It's where that focus is currently in Dr. Shah's research, but we also wanted to make sure that you are aware of other plant-based diet resources that are out there. So Plant-Powered Metro New York is offering a 21-day plant-powered jumpstart program that you can enroll in and join from anywhere in the world. While this program is exciting and we encourage you to join if you're interested, there's no obligation from HealthTree to enroll. We've done several webinars with PTMNY and their dietitians in the past. We also have another one slated for December 3rd, so mark your calendars, and we will send additional information in our follow-up email. Again, this is just one resource. There's a cost involved, so be aware, but loads of different ways to get a jump on a plant-based diet if it's something that's new to you or something that you want to try. As you leave today's session, we would appreciate you taking the 2 to 3 minute survey to fill out 2 to 3 minutes to fill out a brief survey about your experience. The survey will appear automatically once you close the Zoom app. This helps us tailor our efforts towards topics that are most important to you. We have several upcoming events that are specific to the different blood cancer communities we serve, but I wanted to give an overview of some of our cross blood cancer events that you might be interested in. So on Tuesday, September 24th, we have the opportunity to hear from doctors from community clinics and academic centers to talk about ways that they're working together to improve patient outcomes. That link to join has not been created quite yet, but it should be up and running in the next few days. We have a great webinar presentation that we're putting together to round out Blood Cancer Awareness Month, where we've asked experts in several different blood cancers to speak on innovation in those blood cancers. That will be happening on September 30th. Then on Tuesday, October 1st, Diana Valentine, HealthTree's financial program manager, will talk to us about upcoming changes to Medicare, which is something that can affect all of our patients here. So the link to sign up for any of these events and many others is found at the bottom of the screen on this slide, and will also be included in the follow-up email, which you'll receive in 48 hours. With Blood Cancer Awareness Month just around the corner, I wanted to mention that in addition to the webinars that we mentioned, we also host webinars and podcasts and videos. We also have video curriculum called HealthTree University that are disease specific. These programs are currently available for the following diseases: myeloma, acute myeloid leukemia, MDS, chronic lymphocytic leukemia, follicular lymphoma, DLBCL, and myelofibrosis. We continue to expand and add programs for additional blood cancer types as we're able. With Blood Cancer Awareness Month starting in September, we invite you to follow HealthTree's main Facebook page and Instagram account in order to see all of the information, patient stories, and exciting updates that we will publish throughout the month. You can follow those accounts by visiting the links you see on the slide. And as Jenny mentioned, we have great ways to participate through HealthTree. In addition to the webinars mentioned in the last slide, we also have the ability to participate in research. So make sure that you are able to click on and look at the different research opportunities we have. This research on sexual health of blood cancer patients is going to be something that we'll send out as well to make sure you know that we've got coverage in different blood cancer topics that are of interest there as well. We would like again to thank our sponsors without whom this event would not be possible: Pfizer, Regeneron, Johnson & Johnson, AbbVie, Karyopharm, Bristol Myers Squibb, Sanofi, Adaptive, and Genentech. And finally, I just wanted to say thank you for helping us build our HealthTree community. I've added my email to this slide, so please don't hesitate to reach out with any questions you have about HealthTree or any of our programs. I appreciate you all and hope you have a great rest of your day and you are able to join us on a webinar again soon. Thank you so much.